Right, there we go. Well, good morning, everybody. I would like to first thank you all for joining us today for this presentation, and also thank the organizers for counting on us, for letting us participate in this Dairy Goat conference. For the next half an hour, we will be talking about other health in dairy goats, mastitis, and we are going to talk about how we can control mastitis in dairy goat farms. Well, my name is Pablo Núñez, and I'm currently working as a corporate brand manager for the small ruminant unit of the pharmaceutical company HIPRA. Before starting, just a brief mention of my company. I would like to tell you something about my company because we have started working in the US just this year. But my company was founded 50 years ago, more than 50 years ago. HIPRA is mainly focused on prevention, so the most of our products are vaccines, mainly for animals, but since this year also for humans. We are developing the new COVID-19 vaccine. Currently, we are having 39 subsidiaries all around the world, and we are the 5th pharmaceutical company in production of vaccines for animals, being also the company that have put more new vaccines in the last 10 years in the market. So the reason why I'm here today is to talk a bit about other health, mastitis, etc. I always start with this picture. This is what we want to see. A healthy goat with a healthy udder producing a lot of milk. This is what we all want to see on farm. But unfortunately, very often, more often than we would like to, we also have to deal with cases of mastitis. When we talk about mastitis, well, mastitis is by definition the inflammation of the udder. It's a multifactorial disease, so the management is important, plays an important role here. Also, there are some predisposing factors of each animal, genetics, etc. And always there are some pathogens that are making things a bit complicated when we talk about mastitis. There are two main types of mastitis. Clinical mastitis, which is the one that we can identify quite easily, is also known as blue or black bag, depending on the place. The other is normally hard, swollen. The color is different, it's dark, can go from red to purple. If we feel the udder is normally quite hot, the milk coming from an animal with mastitis obviously presents an abnormal color, sometimes clots. It's very painful. It's a very painful disease. Comes normally with fever as well. And one thing that is important is that animals with mastitis, it's quite difficult for them to recover from it. So in many times we have to cool them, or even if they survive, the udder is still damaged. So we have to get rid of them. Then we have the other type of mastitis, subclinical mastitis. This type of mastitis is a bit more difficult to identify when we have it on farm. I always use this picture as well, the iceberg photo. Okay, to explain what actually happens on farm. The tip of the iceberg, it will represent the clinical cases we have on farm, animals having mastitis. When we have some clinical cases on farm, we have to think that there are a lot of animals that are having subclinical mastitis. This one that is not so easy to identify. So there are quite a lot of animals infected in the herd. Animals with subclinical mastitis, the udder looks healthy, looks like a healthy udder normally. These animals can become chronic, and sometimes we can see unbalanced udder. Also, if we feel the udder, we can feel some lumps or hard mass. But not always it's easy to identify them, so we need some additional tests to identify those cases. California mastitis test, that I guess that many of you are familiar with them, and somatic cell counts. We will talk in a minute about that. The main problem of having subclinical mastitis cases on farm is that very often they remain undetected for a very long time in the herd, and they are actually infected animals that are infecting healthy animals. So they are a source of infection for other animals. So keeping them in the herd, we are going to keep also the infection in the flock and the problem. Somatic cell count, we have to talk about it because it's the best other health indicator we can have. Animals that are infected, animals with mastitis, they have high somatic cell counts. Always the somatic cell counts are higher than the somatic cell counts of healthy animals. And this is an important indicator of the health of the other, of our animals. Sometimes we have individual somatic cell counts. So somatic cell counts from each animal, but not very often we have that. Many other times we have bulk tank somatic cell counts. So we can have a general idea about the situation we are having on our farm. So we normally play with these numbers. Just to have a number as a reference of healthy or non so healthy herd, we can take these numbers as a reference: 1 million, 1.2 million somatic cell per milliliter in the bulk tank. So all below that, all below 1.2 million cells per milliliter in the bulk tank will be considered as that the problem, that the mastitis is actually under control in this herd. If the somatic cell counts of our bulk tank is over that 1.2 million, we can think that, well, mastitis is not exactly under control and we need to do something about it. Depending on who you talk to, these numbers can be a bit higher, a bit lower, but we can take this number as a reference. I mentioned also the California mastitis test. Identify animals with subclinical mastitis is not always easy. Actually, I would say it's pretty difficult. So we can, if we have somatic cell counts, we can use that data. If we don't, we can use California mastitis test. We can actually perform this test during the milking when we suspect that some animals can be infected. Very easily, we just need to discard the first stream of milk and use the next milk, put the next milk into each cup of the puddle. After that, we have to add the reaction solution and just rotate this puddle horizontally. And if we find that the mixture is still liquid, this will mean that this animal is not having mastitis. But if, as you can see in the third picture, in this picture, if you see that the mixture forms like gel, it's like jelly, this is suggesting that this animal is actually suffering mastitis. So very easily we can identify animals if we have some sort of, we are suspecting that some of them can have mastitis by using this test. Coming back to the iceberg photo that I showed you before, there are plenty of studies that talk about the clinical and subclinical mastitis. According to this study that was published in 2013, there were a lot of farms included, a lot of dairy goat farms included in this study from the Netherlands. And the conclusion was, if we have between 3 to 5% of our herd having clinical mastitis, we can think that 40% of the animals in our herd are actually subclinically infected, having subclinical mastitis, and the rest of the herd will be healthy. So again, it's the same image that the iceberg image. I mentioned before that there are always some pathogens that are involved in mastitis, in most of the cases. If we talk about clinical mastitis, gangrenous mastitis, black bug, there are especially one pathogen that is the most prevalent one. There are different studies as well that talk about the prevalence, can be slightly different, but all of them have this in common. Staph aureus, Staphylococcus aureus, is causing the most of the cases we have on farm. If we put together Staphylococcus aureus and CNS, so coagulase negative Staphylococcus, 67% of the cases on farm, according to this study, will be causing clinical mastitis. If we talk about the other type of mastitis, the one that is not so easy to identify, we can see that the situation is slightly different, and the CNS, coagulase negative staphylococci, is causing the most of the cases. And together with the Staphylococcus aureus, almost 80% of the cases will be caused by this pathogen, by staphylococci. This is important, and later on you will see why. I mentioned before that mastitis is one of the most important problems we can find in a dairy goat farm, and I actually think that it is very often the most important problem we can find. And I say this based in two main things. First, animal welfare, and second, it will be the economic impact. The animal welfare. Well, we all have seen cases of clinical mastitis. We all know that it's a very painful process, a very painful disease. Animals are in pain. Normally, they also have fever. At some stage, they can just stop eating, stop drinking. They keep themselves separate from the rest of the herd. They are in pain. So the animal welfare is definitely compromised by mastitis. And then we have to talk about the economical impact. If we just think about clinical cases, gangrenous mastitis, the blue bag, even when we treat them, in many occasions, if it's light, they can die, or if they don't die, the udder is still damaged. In many cases, they can survive, but there are some serious lesions in the udder, and finally, we have to get rid of them. This means that we have to replace them, and the cost, the important part of the cost of mastitis comes from for replacing animals with mastitis. I don't know exactly how much this can cost. This is difficult to calculate, depending on the farm, on the milk price, etc., different aspects. But what we all agree on is that replacing animals has a huge cost on farm. If we talk about the subclinical mastitis, the one that animals are not actually presenting clinical signs, we will see later on, but these animals are also producing less milk than a healthy animal. Some of them can become clinical cases as well, so they can have clinical mastitis as well. And in many occasions, for production reasons, etc., they have to be called many times, not always, but many times. There are different studies that estimate the cost of one subclinical mastitis case on farm. This study that I am mentioning here, it suggested that in the Netherlands, the cost per one subclinical mastitis case on a dairy goat farm, it was around 80 euros. We have talked about the replacement. Obviously, this is a huge cost on farm, but we also have to talk about the milk production, right? When we have clinical mastitis, obviously the animals, they stop producing milk, or at least even if they recover from that mastitis, they are not going to produce as much milk as a healthy goat. Depending on when this occurs, the lactation can be very short or not that short, but this is just an estimation of the reduction in milk production that we can have when one animal have clinical mastitis, around 70% compared to a regular lactation. If we talk about the subclinical mastitis, the one that, as I said, the animals are apparently healthy, there will also be a reduction in the milk production. As I mentioned before, animals that are having mastitis, clinical or subclinical, they have high somatic cell counts, higher than healthy animals. There are plenty of studies that associate these somatic cell counts, that data, with the milk production. In this case, as you can see on the table, just being focused on the goat part. on the goat part. If we have a bulk tank with 2 million somatic cell counts, that herd we will be producing almost 20% less milk than a healthy herd, than a healthy dairy goat farm. So we are talking about a lot of milk. If we go to 3 million somatic cell counts, compared to a healthy dairy goat herd, we will be producing almost 25% less milk than that healthy herd. So we are talking about a lot of milk here. So the answer to that question is not easy because there are many different aspects that can actually determine the real cost of mastitis on farm, the milk price, the milk production of the goats, etc. But what we all have to agree on is that the cost of mastitis is really high. It's a really costly problem that we can have on farm. So I would like now to answer the important question here, I would say. We have been talking about mastitis, the cost of mastitis, the importance of mastitis, different types of mastitis, but we need to answer now this question. What can we actually do to control mastitis on a dairy goat farm? Well, the answer is not only one thing, it's a lot of things that we can do here. I always answer this question with this. We need to follow a mastitis control program. There are different things, many things that we should do on farm. Some of them are not so easy to apply because they can look like a time-consuming task, but the more we can do, the better result we will obtain. The more we can do, more easily we can control mastitis on farm. We are going to talk about each one now, just very briefly, because I do not have much time to go in detail, but these are the main ones: the milking machine, milking routine, the chronic animals, chronically infected, the dry-off period, and the environment on the farm. And also, finally, we are going to talk about vaccination, about Vimco, the vaccine that we are commercializing in the US against mastitis. Okay, starting by the milking machine. For me, this is crucial. I mean, we have to think that animals are milked, our goats are milked once or twice a day, normally twice a day. So the milking machine should be working properly. If the milking machine is not working properly, we can be damaging the other, and there is no way we can control mastitis. So it's crucial to have our milking machine checked at least once a year, making sure that all the parameters, the vacuum, the cycles per minute, the pulsator ratio, all the parameters of the milking machine should be okay, the machine should be working properly. The washing after each milking is important. Well, there are many aspects of the milking machine that should be checked at least once a year to avoid possible lesions to the other, etc. If we talk about the milking routine, it's also equally important. Why? Because we are the ones that are milking the animals. So there are different steps that we should follow. The important thing here is to have adequate milking routine, something that milking after milking, we will do. We can highlight here, for example, avoiding the over milking. This is important. Avoiding stressful situations, especially important for goats. The stress can make difficult to control mastitis in our flock if the animals are stressed when they get into the parlor. Obviously, we have to use gloves, avoid the entrance of air in the teat cups. There are different aspects, as you can see here. The more we can actually follow, the better results we will get. The post-dipping, the post-dipping is also very important. Many different aspects to consider. The environment. Controlling the environment is important.
Okay, so we'll be able to go back and watch this.
Can you hear me?
Yes.
Okay. Yeah. All right. Okay. Because there was some sound. Okay, that's fine. Yeah. So the environment. Why is this important? Many of the pathogens we were mentioning before, Staphylococcus aureus, between others, they live in the environment. They live in the bath. They actually live in the skin, in the human skin, also in the goat's skin. So they are in the environment in general. So it's crucial to have a clean and dry, comfortable bedding. Add fresh straw regularly. If the animals are grazing before and after milking, we need to make sure that the resting sites are also clean as well. So all this is going to help us control mastitis in the herd. The dry-off period. This is a crucial period. This is the period in which animals will recover from the previous lactation and they will get prepared for next lactation. One of the typical questions when we talk about the dry-off period is the duration of it. Well, for me, my recommendation is always that this period should last at least 60 days, 2 months. If some authors, they talk about 45 days, well, for me, 60 days is ideal. If it has to be 45 days, it's okay, but never less than 45 days. It's not long enough for the other to recover for the previous lactation. And the shorter this period is, they will not be prepared for next lactation and more likely they can get mastitis. So this is also important. How we can dry off animals? Well, we all know how to do it. Sometimes it's difficult, especially for animals that are producing a lot of milk. Some people, they like to do it in a very short time, in a very short period of time, like in a very few days. Some other people, they prefer to do it progressively. That depends on the farm, on the management of the farm. There's no one way that is better than the other, but we have to do according to our management system in general on the farm. But this period is extremely important. The chronics, animals that are chronically infected, chronic animals, they are animals that they have been infected for a while. They will continue being infected, and sometimes they do not present any sort of clinical symptoms, but they are infected and they are a source of infection for other animals. So keeping them in the herd is very risky because they are going to be infecting healthy animals. So we are not going to control mastitis this way. So we need to try to identify those chronic animals. It's not easy to do it. We have tools to do it, but it's not easy to do it. Things that can help us identify them. Asymmetrical udder, the unbalanced udder I was talking about before. This is very common from these chronic animals. Half of the udder is just smaller than the other one. Also, if we feel the udder, we can feel that the consistency is not as the consistency that we can feel when we feel a healthy udder. There can be some sort of lumps or hard mass. If we have information about the somatic cell counts, individual ones, that can help. Not always we have that information. So again, the California mastitis test is a really important tool to identify those animals. Anyway, as soon as we find them, we should get rid of them because they are being a source of infection for the others, and they are complicated things, I would say, on farm. And finally, we have the last point, which is the vaccination, preventing mastitis by vaccinating the animals. Vimco is the vaccine that HIPRA, my company, is commercializes in the US. Vimco is a vaccine against two main pathogens. As I mentioned before, there were a few pathogens, few bacteria that could cause mastitis, and these two pathogens, Staphylococcus aureus and coagulase negative staphylococci, are by far the most prevalent pathogens that can cause mastitis.
New vaccine came out.
So by using Vimco, by vaccinating with Vimco,
Have you tried it?
we will be protecting animals. We will be protecting animals against 66% of the cases we can have on farm, clinical cases.
Dr. Plummer was excited about it.
And almost 80% of the subclinical cases that we can have on farm. So how can we actually use Vimco? How can we actually use this vaccine? Well, the protocol is very simple. Before kidding, we need to give 2 doses, so 2 shots of Vimco. One approximately 5 weeks before the kidding starts, and the second shot, it will be 3 weeks after that. So approximately 2 weeks before the kidding starts. The dosage is 2 ml, and the administration route is in the muscle, intramuscularly. And now the important question that the most of you will be wondering is, okay, what can we actually expect from Vimco? What can we actually expect from vaccinating our goats with this product?
You want to watch? You can watch this. Okay.
Right. Few things. First one, we are going to reduce the clinical signs. So we will have less clinical mastitis cases in our farm. And when some animals will have mastitis, they will recover more easily from it. So after treating them, they will recover better than without vaccinating with Vimco. This means that we will not need so many animals to replace animals having mastitis. And as I said before, the replacement cost is quite high, so this has an important economic impact on farm. The second thing we are going to get, we are going to reduce the shedding. So animals, they will not be excreting these pathogens so much. So we are going to reduce the risk of infection. So basically, we will have less new infections in the herd. This way is the only way to control mastitis, reducing the shedding, reducing the excretion of these pathogens. And finally, we are going to somehow improve the milk production. I mentioned before that animals with mastitis, they have high somatic cell counts. Animals with high somatic cell counts, so animals that are infected, they produce less milk. We talked about this just now. So by using Vimco, we are going to reduce the somatic cell counts in our herd. And this way, we are going to guarantee that our animals are going to produce as much milk as they should. So by controlling these somatic cell counts, by controlling the infections in the flock, we are somehow going to make sure that our animals are producing the milk we would like them to produce. Again, this has obviously a huge economic impact on farm. Right, so Vimco, as I mentioned before, was firstly commercialized in the US this year, actually. Our official distributor is Premier One Supplies. But Vimco, we started commercializing Vimco in Europe, in European countries in 2014, 7 years ago. Since then, a lot has happened. We have sold the product we are selling the product actually in 3 continents, 19 countries. More than 6 million doses has been administered. This is just an estimation. So we have plenty of experience, I would say, experiences with the product, plenty of field cases that I would like to share with you, but I do not have the time to do it. So I have selected just a couple of field cases that I would like to share with you so you can see actually the results that you can expect from this product, from Vimco. This first case is a field case from Spain. In this specific case, well, we evaluated the efficacy of the product, the efficacy of Vimco in a dairy goat farm in Spain by counting and comparing the amount of clinical cases of mastitis cases on farm and also the treatments that they were needed to treat those animals. This farm has 550 goats. Murciano Granadina is the breed, is Spanish breed. And this farm had a lot of problems of mastitis, a lot of mastitis cases on the flock, and it was diagnosed positive to Staphylococcus aureus and Coagulase negative Staphylococcus. These two bacteria that I was talking about before. We collected data from 2 years before using the product, from 2 years before using Vimco, until 1 year after using Vimco, and we compare the amount of cases and treatments needed. The mastitis, we were basically collecting data from mild and severe mastitis. When they use the product, they follow the protocol. As I told you before kidding, 2 shots, one approximately 5 weeks before kidding, and the second one 2 weeks before kidding. And these were the results from the year before using Vimco and the year after using Vimco. The year before using Vimco, they had 88 severe cases of mastitis, 50 mild cases of mastitis. After using Vimco, they have 61 severe cases of mastitis on the farm and only 5 mild cases of mastitis. So there was an important reduction of severe cases of mastitis, 31%, and 90% reduction of mild cases of mastitis, and consequently, the treatments needed to treat those animals. So this was a first case I wanted to share with you to see how Vimco reduced the mastitis cases on the farm. This other one is a challenge trial. So animals, in this case, they were experimentally infected. And this was performed actually in the US, and it was presented in this trial in the National Mastitis Council in Georgia in 2019.
126279.
For this challenge trial,
0997.
we have 32 pregnant goats, 10 were first kidders, and 22 multiparous. All the animals, they do not present any mastitis clinical sign or things like that. They were negative to serology, so they were free of mastitis caused by Staphylococcus aureus. And we divided these 32 goats in 2 groups. One group was the group that was not vaccinated with Vimco, 15 goats, and the other group was vaccinated with Vimco, 17 goats, and we compare both groups. And these were the results. From the group that was not vaccinated with Vimco, one animal, first of all, one goat had to be culled because she presented serious lesions in the other. You can see the other there. So she had to be culled. The rest of the animals in the group that was not vaccinated with Vimco, all of them presented mastitis. This makes sense because, as I said before, this is a challenge trial, so all the animals were actually infected. So all the animals not vaccinated presented clinical signs of mastitis. In the group that was vaccinated with Vimco, which is the red column, only 42% of them presented clinical mastitis. So we can say that 58% of them were protected against mastitis. Also, we evaluated the alteration of the milk in both groups. And what we observed was that 75%, there was a reduction in the alteration of milk of 75% comparing the group vaccinated with Vimco with the group that was not vaccinated with Vimco. And finally, we also evaluated the other lesions. Comparing both groups, group vaccinated with Vimco and group not vaccinated with Vimco, there was a 75% reduction of other lesions as well. So this is another example of how Vimco can actually reduce the clinical signs of mastitis and the clinical cases of mastitis on farm. So the answer to the question, how we can actually control this important problem on farm, mastitis on farm, my answer to that will be this mastitis control program that I mentioned before. All the points that you can see here, the milking machine, milking routine, the chronics, the dry-off periods, environmental control, the vaccination, all of them are equally important. And the more we can include in our routine, the more we can include in our farm, the better results we can get, and also more easily and more quickly we can control mastitis on farm. But all of them are equally important. Just before finishing, I would like to share with you just an experience that comes from the Netherlands, in which in a dairy goat farm, farmer and a vet decided to use Vimco. And we have a video here, a testimonial video, in which they are going to share with us what they think after using Vimco. I hope the sound is good. Well, it's in Dutch, but it comes with English subtitles, so it shouldn't be a problem.
Ik had gehoopt dat het goed zou werken en ja, dat gebeurde. We hadden een veel te hoog celgetal. Ja, het zat rond de 3000. Kiemgetal zat regelmatig boven de 100. Dus we hadden echt wel een beetje een probleem in de geiten. En dat is de reden dat we zijn begonnen met Vimco. Ja, als je 's morgens blauwuieren ziet dat hij blauwuieren krijgt, dan is hij 's avonds, dan kan je hem wel afvoeren. Als je dat kan verminderen, dat scheelt nogal wat.
Dat celgetal ging eigenlijk heel snel, heel hard naar beneden. Ik denk dat we het wel halveerden in korte tijd.
Ik denk, nou dat werkt goed. Ja, het heeft effect. Het celgetal is gehalveerd, zit eigenlijk weer op normale waardes. Ik schat 50 tot 60% minder blauwuier dan voordat we enten.
We zien verminderd celgetal, we zien minder mastitis, veel minder ernstige mastitis. En dat was een prachtig resultaat. We meten eigenlijk de werkzaamheid van een medicijn wat wij gebruiken, van hoe vaak de klanten voor terugkomen. En ja, ze zijn allemaal positief en ik zou dit vaccin alle melkgeitenhouders aanraden. Nou, daar hebben we echt wel bij allemaal resultaat gezien.
We hebben meer melk in de tank houden en ja, het is ook voor dierenwelzijn veel beter dat die dieren niet uitvallen.
Ik ben echt heel enthousiast. Ja, we zien er gewoon resultaten van. Ja.
Ik ben heel tevreden. Ja, super tevreden.
Yeah.
Okay, that was pretty much all I have prepared for this presentation. Now I think we have time for questions. If in the future you have any further questions, etc., you can contact our distributor, Premier One Supplies. So Jennifer, I think we can, if there is any question. Comments, etc.
We're asking if there's any questions.
Any questions on the Vimco vaccine for Pablo or some other presentation? Is anyone in here using it yet?
So the question was, is anybody here in this room currently using the vaccine?
Pablo, could you address that? The recommendation talks about starting the vaccine pre-kitting at 5 weeks. Is there value if we're mid-lactation and it's new to us now? Is there value to starting that vaccine now, mid-lactation?
Okay, the official protocol, the standard protocol for Vimco is that, as I mentioned, using the product before kitting. We try to adapt to different situations, and especially for dairy goat farms, which are really long lactations, I would say. Many farmers are using the product in a slightly different way. What they do is they start at any point, and after 6 months, they have to give one shot, only one shot after 6 months, and so on. So this way we manage to keep the immune response of all the animals, but we vaccinate the whole herd with that. So basically, if you start today, mid-lactation, you will have to give an extra shot in 6 months' time, and another extra shot in another 6 months' time. And like that is another protocol that we are also following, especially for dairy goat farms with long lactations. Yeah, I don't know if that answered your question. I mean, the standard one, the one you can find on the product when you read the protocol, it will be always pre-kidding, but vaccinating animals every 6 months, one shot, we also obtain the good results as well. So we are also doing that. I don't know if that answers the question.
I were able to hear that answer. Okay, so starting now, if you're mid-lactation and then repeating at 6 month intervals.
The only important thing is the first time that you vaccinate one animal, one goat, this animal needs 2 shots, okay? 2 initial shots always. And
Okay.
after that, if you want to continue using it every 6 months, she will need only 1 shot every 6 months.
Okay.
But the first 2 initial shots are needed always.
Okay. Other questions? No other questions in the room. Pablo, thank you so much for joining us today.
Thank you. It's been a pleasure. Yeah, if anybody has any questions in the future, they can just contact me via email or just our distributor, Premier One Supplies. Thank you very much to everybody.
You so much.
Thanks a lot. Thank you. Have a nice day.
Bye, thank you.
Bye. Thanks.
So again, this was being recorded, that's why I did this stuff to try and volume or presentation. So it will be posted on the Indian Dairy Association website, linked at our fall conference, IDGA.net. It's still